Hi, I'm responding to a video in which a young woman says her younger brother just got diagnosed with type 1 diabetes. So this is my response as a type 1 diabetic. I was diagnosed with diabetes about a year and a half ago when I was 17. I have four younger brothers, and they had some questions, so maybe these are some questions you might have too. One of my brother's first questions is it contagious? The answer is, if you were to have a bone marrow transplant, possibly, otherwise, no. You cannot catch it from sharing the same food, you can't catch it from touching his blood, it's not contagious. The actual antibodies possibly theoretically could be acquired if you had a bone marrow transplant, but unless you have leukemia, I wouldn't worry about that. Question number 2, if it's genetic, am I more likely to get it? The answer is yes, especially if you share the same father. If you're half-siblings and you share the same mother, it's a lower risk. They are imprinted genes, meaning that the genes you get from your father matter more than the ones you got from your mother. You can get tested for antibodies through TrialNet and various other organizations through TrialNet. It would be free. That would give you a pretty... If you are negative, that pretty much tells you you're not going to develop juvenile diabetes in the next few years. If you're positive for a whole bunch of antibodies, then it pretty much tells you that you will. And if you're positive for one, then you're still up in the airs. The risk, if you are a non-twin sibling, depends on what age your sibling was diagnosed and your actual genes, and is anywhere between about 3 and 20%, usually closer to 3. Your risk of developing diabetes is higher if you are male, higher if you are Caucasian. The male to female risk ratio is 1.8 to 1. That is, a little under 2 guys get type 1 diabetes for every every one girl that does. Let's see, what other concerns? A lot of people want to know, do shots hurt? Yeah, they hurt. For some people, they'll hurt a lot more than other people. Individual shots will hurt more. Anxiety will hurt more. When I was newly diagnosed, I used something called an Inject Ease, which costs about $30. There's different devices. Shoots the needle into you pretty fast. Not a whole lot of pain. I ended up losing it a few months later, so I don't use it anymore, but it kind of got me more used to it. Lantus injections hurt more than most others do because Lantus has a low pH, and there's a sting to it. Other concerns from siblings. Your brother is likely to feel pretty irritable when he's very low. Sometimes he's not going to be symptomatic. Don't freak out, you'll freak him out. Possibly, especially if you're the older sibling. Parents also freak out too much. Concerns about exercise and diet. It's not any more important for a type 1 diabetic to have a better exercise or diet than it is for a non-diabetic. Just like with non-diabetics, the difference between being a total couch potato and being somewhat active is huge. The difference between somewhat active and extremely active is small. So I suggest that you be getting some activity and he be getting some activity, and don't worry about it being a ton. Maintaining lower blood sugars is important, especially in younger people especially in people over the age of 2 and under the age of about 60. Yeah, because you're worried about long-term risks more when you're younger and other things aren't so likely to kill you, and because you're not as worried about brain formation when you're dealing with people over the age of 2. You want to check blood sugar, and you don't want to go crazy with it. You want to get a feel for trends. If you're the sibling, don't worry about checking blood sugar. Don't call blood sugars good blood sugars or bad blood sugars. It's not his fault. That's important. No diabetic is trying to get high blood. No. no young diabetic is trying to get bad blood sugar. Some teenagers will try to do that, and even a little older, to affect weight loss. But since you're saying you're in high school and your younger brother is very cute, I assume he's a lot littler and not really at the point where he's trying to make himself lose weight. So I wouldn't characterize his blood sugars as good or bad. They are what they are. You say good for you, you tested. Good for you, you know how to act when you test it. Um, that's important. And don't restrict sugar too much. It's like this. If somebody says to you, don't, what's your first reaction? It's do. Eating sugar, it isn't the greatest thing, but it can be done pretty safely with type 1 diabetes. I do it. Yeah, don't expect perfection. You're not going to get it. You might get it really early on, because sometimes a type 1 diabetic is diagnosed while you've still got a lot of insulin production left in your own body. But if you have perfection now, it's not going to last. As it goes, it's going to go. And in a type 1 diabetic, your glucagon production his glucagon production is also going to get screwed up. It's going to screw up his blood sugars, and they will never be perfect. Not without some really major technological advances. Perfection's not going to come. Yeah. You might be feeling left out right now. And that's okay. You're a person too. And your brother's not the only important person in the family, and he's not any more important just because he's got something scary going on. You have your own emotions about it, and you have your own emotions about other things, and your life needs to keep going too. And it's okay to be sad right now. It's okay to be sad later on. It's not always okay to blame him. It's not his fault. And it's not your fault for feeling sad, and if you resent him at any point, that's still an okay and valid emotion. Although I wouldn't share it with him if I were you. Your family might be interested in the Children with Diabetes conference in Florida this summer. I'm thinking about going myself. They have a siblings group too, with no diabetics allowed, which I think is an interesting concept. Yeah. You also, if you get good at being around diabetes, you'll be in demand by families who want a babysitter who really knows how to handle diabetes. So after a few months go by, you might think about advertising yourself as a diabetic, as a someone willing to babysit kids with diabetes. But also remember right now that your brother is more than a diabetic. Not more than. He is things as well as a diabetic. And he's probably not going to appreciate it if all you talk to him about is diabetes. You probably will get sick of it too. Other things that might concern siblings. You're still siblings. Don't feel bad about doing sibling stuff, like fighting. Which is maybe more of an issue with me and my brothers than it is with you and your brother. He's still gonna be annoying sometimes. Diabetes doesn't make anybody an angel. Yeah. Yeah. Oh. Yeah. Don't assume if you do one shot or one blood sugar test yourself that feels the same way to you as it does to your brother. Sometimes, shots feel different to different people. Blood sugar checks feel different to different people. The shots you get in the doctor's office are probably not all that much like the shots that your brother gets. He'll also kind of get used to it. You can even get diabetic stuffed animals with pumps. I'm reaching 10 minutes. Hope this was helpful. Bye.